Welcome to Dylan's World. My name is Dylan Rothbein. I am Asperger's dyslexic blind. I use a wheelchair. I have non-epileptic seizure disorder, and I experience male to female gender dysphoria, making me a male to female transsexual.
My name is Margot. I have cerebral palsy. I am a biology student. I am not a medical professional, but I have been trained to read scientific studies for many years.
Before we get into the genetics discussion in this video, watch my Lyme disease story and Behind Blind Eyes and the Science of an Inconvenient Rainbow. First, before watching the rest of this video, the links will be in the description.
Dylan has clearly been a scientific mystery for quite a while, and this seems to have led to a bunch of unanswered scientific questions we will try to answer in this video. The first thing you need to know is the basic terms of the anatomy so the audience will understand.
What is collagen?
Collagen is something that holds the body together, like an internal glue that holds body parts and organs in place. This glue is called connective tissue.
Now that we understand the basics of connective tissue, how do we put this into the context of my impairments and the social model of disability?
In the context of impairment, a lack of collagen means that the body is impaired in its ability to hold body parts in place, leading to pain and organs that don't function the way an able-bodied person's body would. In relation to social model, this means a person without collagen must be accommodated with mobility aids of some kind.
Is there a domino effect regarding the implications of a lack of collagen?
Yes, generally, a lack of collagen causes progressive problems, particularly with joints and potentially blood vessels, and can impair more organs as a person ages. It is essentially a multi-system failure.
What conditions involve this multi-system failure?
An example of a condition that involves a lack of collagen is Ehlers-Danlos Syndrome, which is genetic and means that a person does not make collagen, leading to hypermobile joints, skin problems, and sometimes blood vessel problems and eye problems. People with Ehlers-Danlos have developmental delays, speech delays, seizures, dislocations of joints such as the jaw, and in some cases, it is associated with selective mutism. People with Ehlers-Danlos syndrome have trouble regulating their body temperature because of skin problems. Dylan is definitely hypermobile because I remember in early 2022, Dylan was on estrogen gel, and in order to put it on her leg, she contorted herself almost upside down.
Yes, so now we do the questions.
Okay. Can you now, or could you ever place your hands flat on the floor without bending your knees?
Yeah,
Can you now, or could you ever bend your thumb to touch your forearm? You just did it.
yes,
As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits?
yes,
As a child or teenager, did your shoulder and kneecap dislocate on more than one occasion?
yes,
Did you consider yourself double jointed?
yes.
Okay, so the first one is like associated with flat feet, which you do have.
Right. So
Well,
flat feet, that's another one.
yeah, you have that. Um, the other ones you definitely have. We'll just go through them. Musculoskeletal pain in two or more limbs recurring daily for at least 3 months.
Yes,
Chronic widespread pain for more than 3 months,
Yes.
recurrent jointless dislocations or joint instability in the absence of trauma to the joints.
Yes.
Yep.
Okay.
Yeah, I guess okay, so this is like we're your age. You're
Yeah.
not a child or an adolescent, so you're right in the middle. So this would
Biological
be
male.
right. There you go.
Okay.
Yeah, okay, so it's um greater than 5, and you already got greater than 5 for that. And then I'll just ask you the little questions again, I guess.
Yes.
Can you now, or could you have ever placed your hands flat on the floor without bending your knees?
Yes.
Yeah. Could you now, or could you ever bend your thumb to touch your forearm?
Yes.
Mm. As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits?
Yes.
Mhm. As a child or teenager, did your shoulder or kneecap dislocate on more than one occasion?
Yes.
Yep. Do you consider yourself double jointed?
Yes.
Mhm. And then um, you have the skin hyperextendability, don't you?
Yes.
It's stretchy. Yeah. Um, you have the flat feet. Right?
Yes.
Yeah. Hmm. Uh, okay, so this has to do with like scarring and marking on the skin. Do you remember having that?
No.
Yeah. Okay. Then it says dental crowding or a higher narrow palate. When they did the dental stuff on you, do you remember them saying that your teeth were kind of crowded in?
Yep.
Yeah, that's what that is. I knew you had the teeth problem. Okay. Um, and then there's something about arm span to height ratio, but I can't do the math for that one at the moment. Here's the other ones at the bottom. Uh,
So out of 12, that's 4.
right. And they'll like be able to test better for the other ones when you're in there. Positive family history or relatives meeting some of the criteria for EDS.
No.
Okay. And then the last one's musculoskeletal pain and 2 or more limbs recurring daily for at least 3 months.
Yes.
Yeah. Chronic widespread pain for more than 3 months.
Yes.
Hmm. Recurrent jointless dislocations or joint instability in the absence of trauma.
Yes.
Yeah.
Over the course of my journey, trying to find an answer for my seizures, blindness, and wheelchair use, visited many doctors, including many neurologists. One of the many neurologists I saw, based upon a misdiagnosis of functional movement disorder, noticed I was hypermobile, especially in my hands and legs. This is where I received a misdiagnosis of EDS after receiving a misdiagnosis of functional movement disorder.
Functional movement disorder is a condition where a person has symptoms of a neurological disorder, but there is supposedly no physical reason for the symptoms, and all the medical tests are normal. So patients are told that it is due to psychological distress and can be treated with cognitive behavioral therapy to the point where a person can learn to walk again normally. Unfortunately, functional movement disorder seems to be poorly researched and poorly defined, and many people diagnosed with FND actually have a more serious problem. rather than F and D.
Although I did not have a name for my impairment regarding collagen, I am definitely hypermobile, and I have numerous interventions regarding supporting somebody who has a collagen impairment. My interventions began with interventions regarding early intervention for somebody with developmental disability, where I was told I had a speech impairment and global developmental delay, meaning I was delayed in everything. And some doctors suggested Angelman syndrome as a diagnosis. When I entered special education, I received related services in the form of occupational therapy, speech therapy, and occupational therapy. Irrespective of my collagen impairment, I received these therapies based upon my Asperger's, which I was diagnosed with later, showing how interconnected these conditions are. During this time, I was diagnosed with selective mutism, which is distantly related to EDS. During the early child phase of my impairments, I was diagnosed with dyslexia, dysgraphia, and dyscalculia.
How did these impairments affect your ability to play sports and engage in physical activity?
I was never able to run. I did play some sports before I got Lyme disease. I played Little League Baseball just before contracting Lyme disease. I contracted Lyme disease when I was 12 years old. I was also on a baseball team between the ages of 9 and 10 years old. While I was playing baseball, I was never good at running. I was completely unable to run laps. Since being diagnosed with Lyme disease, I used crutches for 6 weeks, and I used a cane during bad weather. Since my decline at age 27, I went from using a cane to crutches to a wheelchair.
In Ehlers-Danlos syndrome, it is genetic and more common in females than males. 70% in females and only 30% in males. In samples of children with EDS or HSD, 6% had autism. Of the 166 total adolescents seen, 17 of those reported having gender dysphoria, bisexuality, and a high level of mobility disability were reported. There is a higher rate of intersex and chimera syndrome seen in EDS. Trans women should be tested for intersex if they have EDS. EDS shares some symptoms like spasticity with cerebral palsy, which is my disability.
Does collagen play a role in our ability to eat food?
Yes, collagen plays a role in the development of the stomach and intestines, so people with connective tissue disorders can be hypersensitive and allergic to many foods, such as fruits, vegetables, and cheese. The body goes into a fight or flight response thinking these foods are dangerous.
I have a history of being able to eat almost nothing. My whole life, I have never been able to eat fruits or vegetables. I used to be able to eat some fruits, but now I can't eat any. Although my whole life I've been called a picky eater, the reality is when I eat fruits or vegetables, it throws off my whole body, and I feel completely numb. I get disoriented and I can't focus.
Some people with EDS and other connective tissue disorders can't absorb vitamin B into their body, and a lack of vitamin B causes nervous system problems like the spine and the brain to not function properly. Dylan's lack of vitamin B is also why she is severely anemic. The blood issues in connective tissue disorders is why people with these disorders should not take blood thinning medications. Unfortunately, the drug Lupron that Dylan took for her treatment of gender dysphoria was a blood thinner, and taking it definitely could have killed her.
What does this do to the nervous system?
EDS and other connective tissue disorders are associated with bulging discs in the spine, leading to severe pain and weakness. In the brain, it causes brain cysts, seizures, brain fog, and spastic muscles.
This is part of why I had a 3-week migraine in Israel while living on one meal a day. How do these impairments affect the visual system in the body?
Connective tissue disorders affect the eye because collagen holds the eye together, particularly the surface of the eye and the optic nerve. People with connective tissue disorders tend to be nearsighted, have astigmatism, retinal detachment symptoms, floaters, and double vision. The term for progressive vision loss from genetic disease is called retinal dystrophy. In Dylan's case, the first sign of retinal dystrophy was her color blindness. Dylan was misdiagnosed as having Stargardt's disease, which is a genetic condition that usually appears around age 14 and causes central vision loss. Stargardt's was a disability that was depicted in my film Dramacided. Dramacided was consulted on by somebody who had Stargardt's in real life.
I have been losing my sight since I was 15 years old. I have been losing my sight steadily for 14 years of my life. However, I've been declining rapidly for the last 3 years as opposed to my previous experience of slower, more gradual sight loss. All right.
Oh boy.
Now let's try with correction.
Right.
With my glasses on.
Okay.
Left eye. TOZFPE.
Okay, so with that eye, you can add on an extra line, which makes you 20 to 70, which is a little further away from legal blindness, but not so good either.
TOZFPE.
Yeah, so the correction does make a little bit of a difference as far as reading.
It's negligible.
Oh, I see. That's cool.
Okay. Oh, hold on. Okay. Okay, I can't see well enough to play this game. I can't see what's going on. You explain what optic nerve atrophy is?
Optic nerve atrophy is a condition where the optic nerve shrinks and degenerates until all of the vision is gone. The vision disappears because the optic nerve and then optic nerve goes to the brain never sends the message to the brain, so the brain never receives the messages being sent from the eye. In some cases, diabetics have optic nerve atrophy due to complications with their blood sugar or from the underlying genetics of type 1 diabetes.
How does brain damage impair the eyes and the balance area of the brain?
Your brain must be able to receive and interpret electrical signals from the eye in order for you to see. If your brain cannot communicate with your eyes, you can have problems with the balance, and if the balance part of your brain is damaged, you can have problems seeing. A movement problem having to do with balance is called ataxia. There is a type of cerebral palsy called ataxic cerebral palsy, where a person has a ton of issues balancing and knowing where they are and where their limbs are. And most people with this type of CP have involuntary eye movement and are unable to track on a page to read and don't have spatial awareness, so math is very difficult for them. In ataxic CP, a person may use a wheelchair because the sense of balance is so distorted and walking becomes impractical and dangerous. People with ataxia can move their limbs so they are not paralyzed and they move involuntarily.
Can you explain the progressive significance of ataxia?
Ataxic cerebral palsy is not progressive. However, if somebody inherits a genetic type of ataxia, it can progress quickly from simply walking with an unusual CP-like gait to using a wheelchair with very little movement in their legs. The progressive type of ataxia can cause seizures originating in the cerebellum that often look different from other types of seizures and are often misdiagnosed. Dylan has progressive ataxia.
A reasonable accommodation that I'm dependent on is my wheelchair. This means that if I'm accepted in any given environment, my wheelchair has to be considered, because the wheelchair is a permanent fixture of my reality. How do embryos form?
An embryo in the womb is formed when it is fertilized. An embryo forms in three layers. The endoderm, which is the innermost layer that forms internal organs, the mesoderm, which forms the muscles of the body, and the ectoderm, which forms the outer parts of the body like skin, parts of the eyes, hair, and teeth. The ectoderm is also involved in the development of the nervous system, particularly the brain.
Are there any impairments associated with the formation of the ectoderm?
Ectodermal dysplasia is when the ectoderm does not form properly because of a genetic mutation, and it is very rare. The person can have symptoms whether or not they have one copy of the gene mutation or two. People with ectodermal dysplasia tend to have teeth problems, be nearsighted, have optic atrophy, stomach issues, and swallowing and speech disorders. They have bad temperature regulation, so if they overheat or are too cold, they can die.
If I eat ice cream, I could die, because brain freeze can cool me down to the point where I could die. If I get a fever, I could die. Point I was in and out of consciousness with a severe fever, and I had to call the Israeli ambulance on myself. What sort of precautions do people with epidermal dysplasia have to take against the elements?
People with ectodermal dysplasia have to be very careful in the sun and must always wear sunscreen and stay hydrated. They have to be careful about scars on their skin because they are more prone to skin infections.
As a modern Orthodox, male to female transsexual, it is my preference to keep my entire body covered as a means of protecting, showing my commitment to my Orthodox Jewish faith and my respect for my futures. As a modern Orthodox trans woman, I express my modesty through wearing pants all the time, despite living in South Florida, which helps me deal with my gender dysphoria. Because my physical impairments means I have trouble caring for my body, and I would have trouble passing if I didn't grow up. While I was waiting for my genetic results, I ended up in the hospital. And during this, I received the genetic results, which were not conclusive of anything, except for being a carrier of epidermal dysplasia. What is a carrier?
In genetics, sometimes you need two copies of a gene in order to have a genetic disability. However, some people have only one copy, so they have the genetic information for the disability in their body and can pass this on to their children, but don't have the disability itself. In Dylan's case, she could pass on ectodermal dysplasia to her kids if she had kids and her partner was a carrier.
Why do I still have some features of epidermal dysplasia without having epidermal?
There is new research in genetics indicating that some people who have only one copy of a gene for a disability can have some symptoms of the condition because the one gene is still able to send the message to the body to create that symptom. This is called overexpression.
The reality is genetics is an evolving field, especially in a disability context. There's a lot we don't know, and there are ethics to be considered, especially in the genetics issues of disability. All things considered, every
Dis-
genetic anomaly discussed in this video is half true. I have some genetic aspects of all the conditions we discussed, which gives me hope my genetics answer is right over the horizon. I will keep looking for my genetics answer for my ever-growing list of impairments that have met dead end. After a series of failed ER visits to address stomach issues and neurological concerns related to migraines in the span of a month, that I have something seriously wrong with me. After not eating for a week, I came to find out that I was in acidosis and would have been dead within hours if I had not gone to the hospital.
Acidosis is where you are not processing things correctly in your body, so your blood becomes acidic, and if it is not corrected, the person will stop breathing and die. In diabetics, it is called ketoacidosis, where their inability to make insulin causes their blood to become acidic and can kill them if they do not take insulin or other diabetes drugs to correct it regularly.
After a week-long hospital stay, I did many tests and an endoscopy, and come to find out I had Pernicious anemia, which does not tell the whole story. Pernicious anemia is common in Ashkenazi Jews.
Pernicious anemia is a rare autoimmune disease where the immune system attacks a part of the stomach and intestines responsible for absorbing vitamin B12. Without vitamin B12, the brain and the ability to make red blood cells is severely impaired to the point where it causes death if left untreated. The treatment is regular shots of vitamin B12 for the rest of the person's life. Referring to this condition simply as anemia is misleading because it is more complex and more similar to type 1 diabetes. Dylan is essentially a vitamin B12 diabetic.
Pernicious anemia is very similar to multiple sclerosis in a neurologic sense. It causes nerve pain on both sides of the body and mental health issues that could cause psychosis if left untreated. I have severe neurologic problems since I have likely been living with this for the last 3 years without knowing it. You have precocious anemia, most likely it won't mix well with Lupron. Considering that vitamin B12 is so important for people who have precocious anemia, I recommend that EMTs carry vitamin B12 shots with them, and that people with precocious anemia should have a medical alert bracelet. My takeaway is never give up, even when the medical establishment doesn't know. It doesn't mean you're wrong, and your impairment should always be taken serious, whether it is documented or not.
My takeaway is that the disabled person knows their body better than the medical establishment. If you are a friend of an undiagnosed disabled person, take them seriously and keep supporting them through their journey. This video has been sponsored by the letter B.
This video has been sponsored by the letter BAT.